Hello, Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome back to my channel. This is Dr. Sana. Today we are going to discuss about reasons for sexual abnormalities in women. Sexual abnormalities or sexual problems in women usually do not come from a single cause. They often result from combination of physical, hormonal, emotional, psychological, relationship, social, and lifestyle factors. Number one is hormonal causes that we all know that there is cyclic hormonal changes are going on in women's body every month, and they are going through these hormonal cycle in throughout their life. So, number one, let's discuss about the hormonal causes. Female sexual desire and arousal are strongly influenced by hormones. Common hormonal factors that influence the female desire are low estrogen level, low testosterone level, thyroid disorders, high prolactin levels, hormonal changes during menstruation, pregnancy and postpartum changes, breastfeeding, perimenopause or menopause. The effects of these hormones or these hormonal changes include, or they shows up in a female's body is like low desire, vaginal dryness, mood changes, reduced arousal, and pain during intercourse. Now, the second one is psychological causes. The mental and emotional health strongly affects the sexuality in women. So, common psychological reasons are anxiety, depression, chronic stress, guilt, shame about the sexuality, fear of intimacy, low self esteem, body image concerns, obsessive thoughts, trauma, or abuse history. Stress hormones like cortisol can suppress sexual desire and arousal. Now, number three is relationship problems. Relationship quality is often closely connected with the female sexual well being. Examples are emotional neglect, poor communication, lack of trust, frequent arguments, feeling unsafe or unappreciated, sexual dissatisfaction, or partner's sexual problems. These causes reduced sexual desires in many women. So many women experiences reduced sexual desire when emotional connection is weakened. Number four is medical condition. Certain illness can affect nerves, hormones, circulation, energy, or pelvic health. Examples are diabetes, endometriosis, polycystic ovarian syndrome, depression, chronic pain disorders, heart diseases, neurological disorders. Symptoms of these may include fatigue, pain, reduced lubrication, reduced sensation, and hormonal imbalance. Number five is medication side effects. Some medications or medicines affect libido or sexual functions. Examples antidepressants, birth control hormones, blood pressure medications, sedatives, some psychiatric medications, etc., affect the sexual functions in women. Possible effects of these medicines are low sexual desires, difficulty reaching orgasm, and vaginal dryness. Now, number six is sexual trauma or negative experiences. Past experiences can strongly influence the later sexual functioning. Examples of these are sexual abuse, coercion, painful first experiences, fear based teachings, and repeated emotional hurt. The effects may include fear, avoidance of sexual intimacy, muscle tightening, and anxiety during intimacy, emotional detachment. Next lifestyle factors. Daily habits influence hormones, moods, and energy. The contributions include poor sleep, lack of exercise, obesity, alcohol or substance abuse, smoking, poor nutrition, and extreme fatigue. Now, next is cultural or religious misunderstandings. In some communities, sexuality may be associated mainly with the shame, silence, or fear. Possible effects of these are difficulty discussing needs, guilt around desire, a fear of intimacy, lack of education about healthy sexuality, anxiety about normal sexual feelings. Healthy religious teachings generally encourage respect, mutual care, consent within marriage, emotional connection, modesty without shame towards normal human biology. Next is aging and life stage changes. Sexuality naturally changes over time. Changes may include aging, childbirth, menopause, long term stress, changing relationship dynamics. These changes are common and not necessarily abnormal. Okay? The important point you should note is that not every variation in sexual desire or behavior is a disorder. Desire naturally changes within hormonal cycles, stress, emotional state, relationship quality, and physical health. When it is medically concerned is that when it causes distress, affects the relationship, and causes pain or suffering, feels uncontrollable, or interferes with your daily life, then you should seek a medical attention. So that's all about today's topic. We are stopping over here today. We will come back with another topic in the next video. Thanks for watching. Assalamu alaikum wa rahmatullahi wa barakatuh.